So my name is Bryce Helgerson. I'm the Chief Administrative Officer for Legacy Salmon Creek Medical Center, and I've been here since January 6th. So over 47,000 patients or people have enrolled through the websites or through other means in the state of Washington, which is outstanding. So the state really has done a great job about getting the word out. They're getting people either enrolled or verified that were already enrolled. And we're starting to see some change from that here within our own patient population.
Oh, great.
So, unfortunately, access to care is an issue, and I think will be an ongoing issue for a lot of these patients. And so, one way that we're trying to address that is make sure that our primary care clinics are open to all payers. And so, we have multiple clinic sites within Legacy Health. In fact, we have more Legacy-owned primary care clinics around this hospital than we do many of our other hospitals in the state of Oregon.
Oh, that's interesting. Okay.
And so we have working on the access to care. We're also seeing changes in our emergency department. So when you look at payer mix, that's kind of our proxy to see whether we're seeing change in terms of Affordable Care Act. We've seen a decrease in the number of self-pay patients. So those are patients that do not have any insurance. Doesn't mean that down the road we don't screen them and find out that they can go on to either a state plan, Medicaid, or Medicare or something else. But we've seen already a reduction in self-pay, a slight increase in Medicaid, and also a slight increase in commercial.
Oh, interesting. Okay.
So
Okay.
those, there are many types of uninsured patients, those that don't have the means, those that have a pre-existing condition that weren't otherwise eligible.
You bet, you bet.
So they're all able to go out and sign up and through the state website or enrolling in some other way. So we're starting to see those changes, and our volumes in our emergency department have also jumped up.
Oh, interesting. Okay.
And so again, that goes back to the accessibility. If patients don't have access, they're going to use the emergency department for either their primary care, or something that's been bothering them for a while, or another health condition that they just want to have addressed. So we've seen an increase in the number of emergency department patients, and now we're in our ED seeing over 60,000 patients a year.
Oh, wow. Okay. Okay.
So back to your original question, kind of how are we changing in terms of the landscape? I think we're going to need to focus on this access issue.
Okay.
And that may mean additional primary care, working closer with the safety net clinics to provide them some help. And then starting to also look at, how many physicians are going into primary care.
Okay.
Can we augment that with nurse practitioners, other providers that provide excellent care to patients and can help us address the volume that I think we're going to continue to see. It could be better in many ways, but I think at the end of the day, it's providing access to people who may not have otherwise had it. And also for us, it's improving the health of the community. So if we're able to improve the lives of people who live in this community, and if the access is an issue, if the insurance is an issue, price, cost, all of those types of things can be either augmented or eliminated for a patient, and that improves their health outcome, then I think it could be successful.
Okay.
But I think that there is definitely some work that needs to be done.
Good.
The addition of the Kaiser contract has placed us in an interesting position where, frankly, we're starting to run out of space.
Really?
And we have, within our medical office building, just a very small shelled space available. And so if we had additional physicians that wanted to come to this campus, there are a lot of developments around the campus as well that where there could be opportunity. But we're space constrained to add physicians on the campus. We're also space constrained in terms of beds.
Okay.
So within the long-term legacy master facility plan, we didn't plan for the need of additional space at this campus because we thought we had enough for the next 5 to 10 years.
Right.
So that's something that...
Good problem to have.
Yes,
right?
it's a good problem to have. And of course, again, back to the Accountable Care Act, I think we will see a shift to the outpatient environment, but it doesn't mean that inpatient beds will no longer be needed.
Okay, good point.
The intensity of that care actually may go up.
Okay.
So we're taking good care of patients in the community.
Right.
When they do need a hospital, they're really sick. And so we're going to have to look at the number of intensive care unit beds and that type of thing. The area is also growing. So as you know, the addition of the Kaiser contract, just the addition of families to Clark County.
Absolutely, yeah.
We've seen a rise in the number of births year over year and continue to see that on a high trajectory. And we're starting to run out of space in that area. So we actually are in the process right now of converting a medicine unit to a family birth type setting where a family could experience the same type of room that they would in our labor and delivery area, so that we keep the medical gases closed off and really kind of a more home type experience than a typical inpatient hospital room.
Sure.
And so we're evaluating what the long-term space needs may be here on this campus. But we're also looking at, in terms of the outpatient environment, where we need to be strategically in the future in terms of our outpatient presence and what types of services we offer in those clinics. We're lucky here at Salmon Creek to have great partnerships with local primary care groups, specialty groups, some of them large, some of them small. And it's always been Legacy's intent to not offer intense competition, but rather partnership first and try to fill in some of the gaps that we see in the community. And so I expect we'll continue to do that.